Ladies and gentlemen, welcome to Everything Etc. I'm your host, Shaman Shan, joined today by Arnie Curtis. Hi Arnie. Good, I'll read you a little intro first. Now, we have a very unique guest today because Arnie is the only male third-year midwifery student at the University of Queensland. So you're going into the dual degree now, the Bachelor of Nursing.
So I'm doing Bachelor's of Nursing and Midwifery, yeah. Yep.
So your journey, or Arnie's journey in a predominantly female-led workforce, is an experience he hopes to lean upon as he works towards his dreams of becoming a doctor.
Yep.
And alongside his hobbies of gym, surfing, rock climbing,
there you go,
etc., etc.
Yeah.
There's a lot there. Arnie is a truly inspiring person, and I'm honoured, very privileged to call him a friend.
Oh, mate.
Arnie.
Don't
What is this? It is great having you on the show, mate.
Oh, thank you, man.
How are
Thank you. I'm doing well, man. Doing well. I'm very excited, very keen. I love podcasts, man. So this is going to be great for my future endeavours, hopefully. But yeah, no, I'm glad to be here. I
have had very good chats coming here today.
Yeah.
Looking forward to it.
Exactly. Yeah.
Yes. So we'll start from the simple one, though.
Yeah, absolutely.
Okay, so Arnie's a midwifery student. Now, for anyone who's listening who doesn't know what a midwifery student is, because I gotta say, that was me, maybe 2 years ago, maybe a year ago.
Yeah.
We won't disclose that.
Yep. That's alright.
For people listening who don't know what a midwife is,
Yeah.
can you explain, like, dumb terms?
Absolutely. So if I were to put it in layman's terms, it's sort of like a healthcare professional that specialises in pregnancy. So it's not just obviously pregnancy, it's more like pre-pregnancy, so preconception care. So that's obviously like genetic counselling, establishing like potential plans for pregnancy. And then we go into like antenatal care where we're talking about pregnancy, educating women about pregnancy, to the labour phase, which is, I love it. It's awesome. My personal favourite. And then you got the follow-up, which is postnatal.
Yeah.
And the timeframes between that is from delivery to 6 weeks.
Okay.
And then from 6 weeks onwards, the GP sort of takes over care in terms of baby and mum.
Mm-hmm.
So in the basic overall scheme of things, a midwife is basically someone that specialises in pregnancy.
Okay.
Yeah.
So how early does this care start? Like, when do you actually start caring for the mother?
Yeah, so it depends really on your position. So as a preconception midwife, you're probably going to be looking at the mum way before she conceives, right?
Yeah.
But the care usually starts around 12 weeks. That's when the woman starts getting all her testing done, all her blood tests, getting scans done, like morphology scans. And
what's the morphology scan for?
Oh yeah, so for anyone, a lot of people are like, okay, well, a morphology and a dating scan, sorry.
Yeah.
So a morphology scan is sort of just like a scan that we conduct during the 12-week period where we conduct basically a full body scan of the fetus. So we're going to make sure that the fetus has any sort of like normal structures. In addition to that, we're also looking for any abnormalities.
Yeah.
So things like trisomy 21, which is Down syndrome, and we're looking at particular anatomical features, anatomical sites, I should say, like nuchal folds, and there's a particular value that the nuchal folds need to be in order to say that this fetus might have Down syndrome later on. So, and a dating scan is obviously just when the baby's going to pop out, like, what's your gestation? Because a lot of mums are like, I don't know when my last period is, or like, because we always, when we're doing gestations, we always go from the last menstrual period. But, you know, a dating scan sort of reinforces those findings. Those are the things that we do during the antenatal period, as well as education. So, like for high risk mums, we're looking at
what are high risk mums?
Oh yeah, so any high risk mums are sort of like anyone who had a chronic condition before pregnancy. So like any cardiac conditions like mitral stenosis and all that, we sort of just plan ahead of time. So we sort of call in the people that aren't necessary, so cardiologists, hematology, and we might call the pediatrician if there's any sort of problems with the baby. There's other cases that happen in pregnancy, like gestational diabetes mellitus, which is for those people that don't know, is diabetes that is obtained through pregnancy.
Yeah.
And without treatment, that could cause potential effects with the fetus. One of them being macroscomic babies. babies that are bigger.
Yeah.
And you'll see if the mum has GDM because the babies are quite fat.
Yeah.
Like they got the little what I call cinnamon rolls.
Oh yeah.
And, they're so cute. Like I'm gonna be honest with you. Like you chug it. You're like tugging on their cheeks. It's like so cute. But obviously with that, we got to make sure that monitoring is imperative for high risk mums. If we don't do that, we're not really doing our jobs, and that causes detrimental effects for both the mum and the baby later on in life. So So and then for those that are like pretty chill, there's no complications. We sort of just follow up on their cares, making sure that they're okay. Because as you know, pregnancy is a big mental game. Yeah. Like it's not just physical; it's psychological. So yeah, we have to make sure we're reassuring the mum. We're also making birth plans. So hey, what are we going to do for this birthing process? What do you want in terms of pain relief? And so just those things that we usually talk about in the antenatal periods. Yeah, and then labour, of course, is the sort of like the showdown, sort of like the grand final, if you will. Yeah. So for those, just labour is labour. There's no real like sugarcoating that. Mm-hmm. It's either coming out, naturally, or it depends if there's any sort of complications during labour. We'll also flag that with obstetricians, or if we have any sort of like special birth plans like water births, vacuums, which I'm sure we'll be talking about later on. Stay tuned. Stay tuned. And like pain relief options like the epidural, which I'll explain as well, the gas, and more natural remedies like aromatherapy. Which is I believe in it, but there's a lot of scientific reports about it, and I don't want to get into too much detail just because our viewers, I don't want to like make our viewers yawn. But it's just aromatherapy, electrostimulations, sterile water injections.
Oh, really?
Ooh, yeah, that one stings. Ooh, yeah. Don't have that one, guys.
What is you just injecting water?
Yeah, so you're injecting water into the epidermis, which is the skin layer, right? Mm-hmm. So you're injecting water into the epidermis, and it basically provides a stinging sensation, and it causes that stinging sensation basically distracts the mother from the labour pains. It's effective for some mums, but obviously, it's not effective for all mums.
Yeah, so that does not sound ideal.
It does not sound ideal because the sterile injections are actually injected into our backs, like near the spinal column. I don't know why I was turning. I was like, okay, but it's down the lower lumbar region. Yeah. That's where we inject the water injections, with the sterile water into the epidermis, and so we do 4. We do 4 sites. So we have 2 midwives that do it, and then we will inject water into one site, and then water into another site. And it's explained in a way that's like, it's like getting stung by a bee. It's a pretty... So that stinging sensation happens for a minute, and then later on, the labour pain is supposed to go away temporarily. But...
because they're like fixated on the pain.
Fixated on the pain in the back, So, that's the overall mechanism for sterile water injections. And then we've got postnatal, which is like... after. Yeah,
it's a little game I want to play. Now, Arnie's seen these questions already, but we'll pretend he hasn't. It's a chill little game. It's a would you rather game for you as a midwife. Okay, now, there's 3 scenarios here.
Okay, go.
Okay, I just want you to pick one.
Okay.
Give us a little explanation as why you picked it.
Okay. Understood, yeah.
The first one is, would you rather deliver a baby on a bus or an airplane?
Ooh. See, that's interesting. Because I know there's international laws. If you deliver a baby on a plane and you're over international waters, I've seen the laws about that. That's crazy.
How does that work? Are they like...
It's quite weird. It's like if the plane's on the... I'm not too sure. Don't quote me on this because I've seen this on a... TikTok. Actually, this is probably bad. Not to mention TikTok. Sorry, guys. But I'm not too sure. You know what? I'm just going to say I'm not too sure about the international laws when it comes to babies being born on a plane.
But what about like medically? Like with the equipment, the modes of transport?
Honestly, I think the bus is more beneficial because the bus can go to the
hospital.
Can go to the hospital, and obviously provide care. But obviously the woman's privacy is absolutely breached. You're going to have people looking, and if you're going to be the only healthcare professional there, you'd rather be on land than in the skies. Mind you, people have delivered babies on a plane, but like, again, I would recommend, if I had to choose anything, the bus. I know it's not sterile, I know it's going to be awkward, but hey, at least we can get to a hospital.
The second one is,
yeah.
Would you prepare an injection? So like, I don't know if you prepare the epidural injection.
I don't do that. That's anesthesia. But let's pretend I'm an anesthetic doctor. Yep.
I was maybe subcuts. I am something that I would do. Would you prepare the injection while walking on Legos, or while you're upside down?
Let's think about this, guys. If you're upside down, it'd be like, imagine if you're Spider-Maning it though.
Right.
Like, upside down, like.
That's insane. Prick yourself.
Just think.
For those who don't know, the general process of preparing a needle is like drawing it up
and stuff. So it's gravity, obviously. Like
yes, but if you're using the ampule, it's not going to fall out, is it?
Yeah, true. But like, you don't want to. I hate myself because sometimes I might be a rock climber, but then little tiny ampules, right? I sort of just drop. I am known for dropping ampules, and it's so bad.
Yeah,
I'm known for dropping ampules.
I really want to get one of those like ampule crackers.
Oh my god!
Like the ones, a lot of the wards I've placement on, they don't have them on, but they're so much easier. And I've seen people like do it and cut themselves, like, bro. If you're opening heparin and you're gonna have to hold that, man. Like,
hey, guilty as charged. I was always the person that cracked the ampule. Like somehow I just didn't know, and it got to the point where I was like,
well, you just like push and pop.
Yeah, push and pop, and I was like, I got to the point where it did crack in my hand. I was like, oh crap, it's cracked. My hands were full of blood. I wouldn't say like excessive amount of blood, but it was just like obviously got little shards of glass. For
context, an ampule is like a little kind of like teardrop shape of glass. The top part doesn't have any medication in it. The bottom part doesn't. You tear it on like a seam. Yeah. Or like you pop the glass off at a seam, and then the ampule has the medication still underneath that.
I cracked that. I cracked that bad boy. Ooh. Went all over. I was just really embarrassed because I was like a second year, and by the time you'll be like your own practitioner, and so that was going through my head, and then I remember just being reluctant for the rest of my placement.
When was this, Sem 1?
Sem 1, yeah. Ooh. Even up to Sem 2, I was scared to, like, I told my midwife, I have to wear gloves. Yeah. Otherwise, I will not feel safe with. Yeah. So the ampule cutter, I really do want. Just to like shove it down your pocket and be like.
Because you can get like little pocket ones.
Yeah. I'm like, why doesn't the hospital have why don't their hospitals?
Because in all the clinicals we do have them. Yeah. And they use them in like what do you call them? What are they called now?
What's the
CBL examination?
CBLs, yes.
ANSATs? No, not ANSATs. What are they called? Oh, I've just forgotten now, haven't I?
Oh my god, we haven't been at uni, guys, for a very long time, so...
but the examinations for our clinicals...
OSCEs and Oscars.
OSCEs and Oscars. I use them all the time. I'm not using my hands in those.
No, me too. Yeah. I always get taught, make sure the little dots away from you. Mm-hmm. But, like, again, I'm chucking gloves on because I don't want them shattering in my hands. So, back to your question.
Yes.
Legos or upside down defo? Oh, God. Wow, that's a hard one, hey?
Right.
Gotta think about it. Like, Lego. Can I move the Legos?
No, you just
just gotta walk.
Okay. Imagine they're like glued down.
I know.
You're gonna step in Legos every time you take steps.
I'd rather comfortability injecting someone than not feeling comfortable. So I'm gonna have to choose upside down.
Upside down.
I'm gonna have to sacrifice it either way. The little tiny ampules.
As a rock climber, I can see how you'd be.
I know.
Maybe a bit more proficient at it.
Yeah.
If you don't pop the ampule.
If you don't pop the ampule. These big grippers, man. Like I tell you, shatters in your hand. So it's gone through a lot. So as you can see.
There's a lot.
The calluses, bro. Go to the gym.
That's experience.
That's experience, bro.
Exactly.
Yeah.
The next question is: would you rather deliver a baby with your eyes closed or underwater?
Done both.
Have you actually?
Well, not underwater. But like I wasn't drenched. I've done both. I remember closing my eyes on my first time. Oh, that was not good. I was just like, you need to keep your eyes open, Arnie, because you've quite literally got a baby's head down there. I would say underwater. I do like underwater. I do like water births.
That's not very... Is that like sterile?
It's not sterile.
Yeah.
No.
Of course it's not.
No, there's obviously higher risks. Like the woman's pooing. The woman's more prone to pooing in the thing, but they don't notice it because we pick it up.
Yeah.
Quite literally grab like a little fishnet into the bin. You don't even notice it. But I'd rather do it underwater because it's just more fun.
Yeah.
Just like when the baby pops out, like it just it emerges it emerges, and I'm like, that's
like
so
that
cool.
You know that Nirvana album cover.
Yeah. Quite literally, I think about that sometimes. I'm like, damn. I just think about that album
Just
cover.
floating out.
But yeah, no, I'd rather underwater.
Underwater, yes.
Yeah.
Because you really need to see what you're doing.
Yeah, exactly. And I did that my first year. Don't do it, guys. Yeah, if you ever become a midwife, don't close your eyes. Just keep them open.
Now, next question is, it's a bit... I'm going to test you a bit more.
No, that's okay.
If you had to explain the birthing process in the simplest way possible to the viewers that may not understand what's going on, how would you do it?
Easy, guys. You got to just obviously from a man's perspective, it's hard.
Yeah.
If you're it's quite hard because obviously I will always mention this. I don't have it. I'm going to be honest with you. I don't have the parts to reproduce.
I'm going to be honest with you, but
I don't have the parts. I cannot relate to
Yeah.
whatsoever. But I can be appreciative and I can use my textbook knowledge to assist.
Mm-hmm.
But
I'm sure a lot of the male viewers don't fully understand what's going on.
oh my man, I love explaining it to the partners, dude. I'll be like, yeah, just the body's going through this, and this. But what you need to do when explaining the labour process, and especially in antenatal care, because that's when you want to do it. You don't want to do it when she's in labour.
Yeah.
When explaining it to them, you just be bare basic. You know, everyone's health literacy is quite different.
Mm-hmm.
Like, if you were to explain the birthing process to a doctor or a nurse, they're gonna obviously understand particular things. Probably not nurses, but if the person was a midwife, for example, you can use some sort of level of high health literacy. But if you're going to be talking to a mum that's either from a different country, because that's very difficult.
Yeah.
That's very difficult.
Language barrier.
Language barrier, translation. Like, honestly, I'm on Duolingo, bro, and I'm learning Spanish, man. Like, on los Spanish, bro. You just got to, consider the way you formulate it. Okay, so if the person's, obviously high literacy, you're going to be like, okay, yeah, we can utilize all the complex terms. Like, she's going to know oxytocin. She's going to know what that is. But if you, let's say, for example, you got a person that's from overseas, from a different country, or you have now this is a real issue. I don't want to alienate this, but if we have a mum that's below the age of 18, she's not going to understand. Mm-hmm. She might not understand, I should say. So you just got to go through the entire process. So this happens to your, you got to explain what happens to the physiology part. So this is where your knowledge comes in, man. This is why you get 10 lectures. I tell people you can watch them online, but 10 lectures, guys.
Yeah.
But
that's a lesson I need to learn.
That's a lesson I still need to learn, and I'm in third year, bro. But just go through the process. So during pre-pregnant, during your antenatal phase, your body's preparing itself, right? The uterus, is going to be highly sensitive in the love hormone, and when the process is ready, you're going to feel a lot of pressure down in your pelvis, or your pelvic area. And then afterwards, your oxytocin receptors are just going haywire, the oxytocin's going haywire. And then...
What is oxytocin?
It's a love hormone.
Oh, okay.
But oxytocin, in the sense of pregnancy, is what causes labour to occur. So
what about in the sense of not pregnancy? What would you define oxytocin as?
I would just say, just the love hormone in the sense that causes attraction. I'm not too sure.
Okay.
Yeah, I only know, guys.
Okay, but that makes sense. So it's the it's hormone that begins pregnancy.
Begins pregnancy. Yeah. And then you got, your cervix ripens.
Sorry, not begins pregnancy. Begins the birthing process.
Yes.
Yeah. Okay.
Your cervix then ripens.
Mm-hmm.
It dilates. It changes its position based on baby's head, and then you explain what breaking the waters mean, because you say the term breaking the waters, but people don't know what it means.
Yeah.
So that's basically, so you know how babies are in a big sac, got the placenta here, but around it is the membrane, and when obviously movement occurs in the uterus, that pops. And obviously that's what we call breaking the waters. Now,
so what's popping? The
membrane.
The membrane around the baby.
Around the baby,
yeah.
not the placenta.
So so we have the cervix. The placenta's at the back of the uterus?
Oh, it could be anywhere.
It can be anywhere. Okay.
Yeah,
okay.
yeah. So it can be anywhere in the uterus, and that's why we have to consider specifically where the placenta position is, because that could be very difficult for fetal monitoring. But yeah, just to explain that the placenta is attached there, the membranes around it will pop, and you're going to feel this gush of fluid. Okay, so you're going to feel this pink fluid down there. All normal. That means labour has started. And then from there, we're just monitoring. We're just going to be monitoring if your cervix is ripening and stuff. So we'll use obviously language like dilation. But if I was talking to another midwife, we're not going to be just using the word dilation. We're going to be using words like effacement and station. So effacement is insinuating. So if I were to, I always like visual representations, and I always explain it as a midwife with visual representations. But when your cervix is like obviously this small, right, lengthways, it's going to be probably long, because a cervix is sort of just like, can I draw a picture?
So for anyone listening via audio, Arnie's just drawing the cervix right now.
So that's the cervix when it's undilated.
How would you describe the cervix? How the cervix looks to people listening via audio?
Yeah, absolutely. So it's sort of like a donut shape. On the external part, it's the donut shape. Sort of like that. That's what the cervix looks like. The bottom one, by the way, guys. And it sort of looks like a donut shape, and then it looks like down like a tube. And then obviously you've got your little uterus on top. So this is like upside down, sorry. But yeah, it's like a little tiny donut shape, and that's what we call the external os, I should say. The internal os is more deeper inside the it's more deeper inside the uterus itself. So it's the entrance. So you've got your uterus, the internal os, and the external os. So
and then the cervix will be facing towards the exterior of the female's body.
Yeah,
the uterus is above the cervix.
So when you're not dilated, your cervix is actually more posterior. So it's more towards the back.
Yeah.
And that's why we tell mums to put their fists underneath their back, so we can move the cervix, and so we can get a better feel of like how we do vaginal examinations. So we get a better feel of like, okay, yep, she's probably 1 centimeter. I don't feel anything. So yeah, so what I mean by 1 centimeter dilation is obviously how dilated the cervix is. So obviously 1 centimeter is sort of like, and you'll learn this as a midwife, 1 centimeter dilation is probably like this, or something a bit smaller than that.
So like a finger's...
It's just a finger.
Finger into the cervix.
It's into the cervix. Now, effacement is sort of just like... It's sort of like when the baby's head's pushing against the cervix, this all flattens. So this entire cervix flattens, basically. And so what that happens is, when we say, so 1 centimeter effacement, that means you can quite literally put a finger in there. Yeah. When we're fully effaced, you can't feel that. All you can feel is the baby's head. Basically.
Also, the baby's head is coming through the cervix.
It's coming through the cervix.
Okay.
It's coming through the cervix, and the entire cervix, you just feel the baby's head, and you might feel like a very thin layer of the cervix around it. That's what we call fully effaced. And obviously...
So is that the fully... What was that? The fully effaced?
Fully effaced.
So what... Oh, that's just when it's... What we call when it's coming out.
Yeah, when it's coming out. So the baby's head's completely compressing the cervix, right? Yeah. And so when you put your finger around it, it's sort of just like a very thin, thin. It's very thin, and that's what we call fully effaced. Yeah. Now, stations is a bit interesting. It's basically where the position of the baby's head based on the spines of the pelvis. So, like, I gotta remember my anatomy now. I think -1 is all the way back, but then if we get +3, the head's like fully, like, not from spines, but it's like fully into the cervix, like it's like the cervix is faced, where like 9 centimeters dilated, we've got progression, like the baby's head's progressed to that point where we can deliver the baby. So that's what it means by that. But we will explain it to you. We'll say, you've been fully effaced. I don't feel any bunch of the cervix. Your baby's head's like progressed well. Baby's head's positioned. You would also talk about baby's head's position. I won't go into too much detail. There's actually quite a lot. Yeah, this is like, pretty full on. This is full on, yeah. Like ROL is right occipital posterior, and like you got to remember and you got to feel it. A lot of all the midwives that I've worked with have visual aiding tools. Yeah. To feel to know where the baby head is, because it just feels quite weird.
Yeah.
One person will say it's ROL. The other person might say it's, LOP.
Yeah.
And like, what the hell? What are we doing?
But like simply in this phase,
Yeah.
the woman's water is broken. The baby's head is starting to move out of the cervix, and as it moves out the cervix flattens out.
Flattens out and
begins to dilate.
It dilates.
Okay.
Yeah, and then obviously progresses through the birth canal. And that's how you explain, I guess, labour to a person. But then you explain the part where we're pushing. And so when we're pushing, we always push during contractions, right?
How do you know it's a contraction?
You'll feel the abdominis, the rectus abdominis, quite literally tighten.
And this is also for the midwife.
Yeah.
The baby.
Yeah. So we usually have we'll usually fill. So we'll fill the belly, and obviously if you can feel it quite tight and quite hard, like you will feel the uterus rock hard. You know she's going into contraction. You can see from the lady's expression, and you look at her and you're like, okay, yeah, she's going to have a contraction. So that's when you tell her to push. And when we tell women to push, we tell them to push like you're taking the biggest poo that you've ever had in your entire life. Like imagine you were constipated for 30 days and your bowels have just wanted to move.
Yeah.
And so you're just taking a big poo, and then afterwards, we always, when we have visual of the head, we tell mums to blow candles, like the baby's heads and the vagina.
So the head has come out? Or
the head's come out?
Yeah.
Oh, wait, no, the head hasn't come out, sorry. The head's about to come out.
Yeah.
We tell the woman to blow candles. If she pushes too hard, well then that's going to obviously cause greater tears, like perinatal.
What do you mean by blow candles? Just like don't push as
go.
Okay.
So just blow candles, sort of just like, just relax a bit. We've got the baby's head here. We just need you to relax a bit. We need to go like blow candles, and then afterwards, when we have the visual of the head, we then another contraction. Tell the mum to push, and then we sort of control the baby outside, like exteriorly. So we always put our fingers underneath the armpit, and then just go down and then up.
So is it harder for the baby to come out between when the head comes out, the neck and then the shoulders? Is it harder for the shoulders to come out? After that?
Not really, but there are cases where it can get stuck.
Okay, because the head is the biggest part of the baby.
Yeah, head's the biggest part of the baby. It's obviously dictated by the baby's position as well.
Yeah.
So if we know the baby's position is ideal, then we will obviously, it will basically come out with ease. But if there is a time where the baby's position is not ideal and we go into a situation called shoulder dystocia, that turns into an obstetric emergency. And
what's that?
So basically the baby's shoulders are stuck.
Oh, okay.
And so, if you keep it there a bit long, well then we're going to have some problems. But yeah, we got a bunch of maneuvers and contingencies in order to do so, in order to assist that process from not happening again, from not ever happening. So we always tell the mums to have their legs upspread like this, opening your pelvis, and then obviously just blow candles, and then we always educate about women afterwards. So
okay. So just recapping, the water's broken, cervix is opened, it's flattened out. The baby's head has started to come out. You can see the head coming out.
You can see the head. Yep, and we also do vaginal examinations to make sure babies are progressing really well.
Okay, so what would that entail?
What do you mean?
The vaginal examinations as
So obviously vaginal examinations, you literally put your fingers inside and you're feeling for the dilation. Okay. Head position. Yeah. We're also feeling for effacement, so how thin is that cervix? Has that is that cervix thin or thick? And then we also look at the stations if you can. You can try, but yeah.
What do you mean by stations?
Oh, so it's basically baby's progression through the birth canal.
Okay, got it.
Yeah. So that's what I mean by stations. So yeah, so those are the things that we do.
And this was like the -1+3 thing you're talking about.
Yeah. Hopefully I got that right, guys. If anyone watches this and is a midwife, please don't blame me for this. Okay.
But I mean, the question was just a simple example.
Yeah.
And it makes sense. So the baby comes out. Once the baby's head is about to come out, you're going to tell the woman
to blow candles. Just blow candles.
And you're going to feel those contractions by the
so we put
tightening of the abdominal region.
Yeah. So we'll feel your contractions and we'll be like, okay, you've got a contraction happening. Let's go. Let's do this.
And then they start blowing the candles. The head comes out. Once the head comes out, you're going to grab the shoulders and just
grab the shoulders and then lift up and then put the baby on your chest region, because skin to skin is very
On the
important.
baby's chest,
Oh,
the
on
mother's chest.
mother's chest, yeah.
That would be weird with it.
Yeah, put the mum on the baby's chest. Yep. No.
And for people who don't, I'm sure there's a few guys listening who may not understand, or ladies, there is a second birth, right? What is that?
What do you mean? Oh, second birth.
The-
Second birth. Oh, I just thought about
miscommunication, guys.
Dude, I thought about twins for a second. But second birth is the birth of the placenta.
Yes.
And so
So is that just the same process as the?
quite literally, yeah.
Is it easier for the?
So what we do in that case, there are two types.
Yeah.
So we got active and the natural process, which is where the placenta is sort of just birthed by yourself, and that's where mums sort of stand up on like a little walker or stand in like the toilet or something like that.
Yeah.
And just try to birth the placenta. But active third stage is sort of just an injection that we give into your leg. It is oxytocin again. That causes the separation of the placenta from the uterine wall.
Mm-hmm.
And so we have to make sure that this separates pretty good. Otherwise, if we don't, there's
You're like ripping it off.
Yeah, you're ripping it off, right? So you're injecting this, and then you're sort of like pulling the placenta out. And what you're making sure is we have that cord lengthening. So the cord lengthens, that means there's some sort of separation. You see a gush of blood, again, separation. You might see some clots, all normal. And then you sort of just follow the birth canal. So when you notice that you can see it, you just follow the birth canal. So you go down and then up, and then you birth the placenta, which is this big. It's like I don't know how to explain it. It's like I wouldn't say the texture's like meat, right?
Mm-hmm.
But
Like
obviously,
meat.
of course it is.
Yeah.
But the surface, this part where the placenta attaches to the uterus, right? It's like cauliflower. It looks like cauliflower.
Oh, okay.
There's obviously you got all the
They're like the blood vessels.
and all that, but then you got these little white parts, and that white parts is calcification, so that's quite normal in pregnancy, in placentas. So that's what it means by the second birth. It's obviously the birthing of the placenta, because you don't want to keep that in there.
That is not good.
No, otherwise you have some blood vessels exposed, and that causes a hemorrhage, and you don't want that to happen.
Ooh,
So
okay.
Yeah, but I'm not trying to scare you guys, but we obviously, as midwives, we always consider about the woman, and we always consider about the woman's health and safety, right? So we have guidelines to prevent any sort of hemorrhages and all that shenanigans. And if the placenta doesn't remove itself from the uterus, we've got procedures and guidelines in order to rectify or to solve the issue at hand. But majority of births that I've seen have been pretty good. I have delivered 14 babies, like vaginally, and the rest I have done with cesareanly. I don't conduct them at all, of course, because I'm not a doctor. But you obviously stand there in theatre, scrubbed up. It's so good.
That'd be such a cool experience.
It's so good. Oh god, it really puts you in the mindset of like, I'm gonna be a doctor one day.
I really want to do that.
I want to do that. Yeah, and then that's the thing. And I was like, that's where I want to be as a doctor. I want to be in this type of setting.
Yeah.
Surgery is awesome, man. But all scrubbed up and all that. So overall, I think my total is up to 27, if we can counting Caesars, because we don't count Caesars.
Yeah.
But I've got 14 vaginal births.
That's pretty good. You have some crazy stories about that, but that's a story for another day.
Yeah, that's a story for another day. But no, it's good. Like I haven't had that many complications.
Yeah.
I've had pretty good births, and like majority of them have been pretty good. The only reasons why I had a pretty high Caesars is just because women either choose or just have had like maternal choice and all that shenanigans. But I don't want anyone to be scared of labour. It's a normal process.
As a guy listening, you talk about this as a male midwife. It's like incredible how
it's awesome.
Incredible the female body is.
It's so awesome, and I honestly, and it has made me appreciate my mum quite a lot.
We love
quite
that.
a lot, because I remember
mothers always need more appreciation.
Exactly.
I can speak for that
Exactly.
too. Talking about being a male in the midwifery area, do you have challenges like being a male?
Oh yeah.
What are some of those challenges?
First one is obviously mums that think, that just don't want a male at all.
I just completely understand.
And you can't fight that. That's awesome. That's all right. It's quite multifaceted as to a reason why. Some of them are more harmless than others. One of them is cultural. So a lot of Middle Eastern cultures don't accept males in the birthing space, or like male healthcare professionals in the birthing space, only the husband. And I have been kicked out of a couple of rooms because of that. Even being told, hey, is it alright for me to be in this space? And the woman said yes, but the dad doesn't agree with it, or doesn't like it. So it's fine. I find that pretty cool, pretty chill. But to more harmful ones, I would say, like, and this is obviously the real world of like obstetrics. I don't want to scare anyone, but sexual assault victims. Yeah. So you just kind of, as a male, you just don't want to be in that space anyways, because you don't want to cause that woman more traumatic stress. In addition to that, you, as well as there's a couple other ones, just like by choice, they just don't want a male at all, and you just respect that. But yeah, no, women have felt uncomfortable with me being in the room while they breastfeed and stuff, and again, that's all normal. But yeah, no, it doesn't harm me at all, but it does really affect your experience, because all my female companions and like counterparts are getting in deliveries and stuff like that. I mean, I've gotten a lot of deliveries, but mind you, there was a lot of rejections and a lot of like, oh, we don't want you in the space. I was like, okay, that's okay. Yeah.
I've actually got some stats here. I've got in 2023 and 2024, there were 34,510 midwives in Australia. Yep. So they were about 3.7% of all healthcare professionals in Australia. Yeah. But out of that 34,510, only about 1.5% of those were male. Yeah. And using like the previous stats, that means there were approximately 518 male midwives. Yep. That's a big difference. 1.5%. Yep. Workforce is a really big thing.
It's so small. We're such a small community, and when I see another male midwife, I'm like, yes!
Yeah, like that must be a really rare thing to see.
It is rare. And there's a midwife that works at my hospital. Yeah. Male midwife, and him and I just get along pretty good. I'm like, yes. Like I get really excited. I'm like,
that's great. I know with male nurses, I get along really well with male nurses.
Yeah, because it's like homies with homies. You know?
Right,
we have the same brain, brain capacity, and it's
Talking about that, do you get do the female midwives sometimes treat you differently because you're a male?
Not at all. No, they don't treat me differently at all. They're just I actually got a lot of attention. It was like, in my first year, a lot of the midwives knew about me. I was like, "Oh, this is great, guys!" But a lot of I've gotten along with my midwifery preceptors and all that, and I love them to bits. Oh my god! And some of them came here to UQ, and it's like, "Oh my god, we can relate and
stuff." That's actually really nice.
And I've got them on Instagram and stuff, and I love them. And I love I call them my sisters. If you are my sisters,
that's actually I can imagine how like a professional in the midwifery space, they're like delighted or happy to see a male.
Yeah, exactly. It's like
undertaking that,
and then it's like, good on you, because a lot of my female counterparts are like, you're gonna be a great husband. You're gonna be awesome.
Honestly, you will.
You will be an amazing husband.
You're about to be in the delivery room being like, hey,
hey, exactly. And they'll be like, yeah, you're gonna be an amazing husband, one day. And I'm like, oh, thank you.
You will be.
That's a blessing.
Do you think you'll deliver your wife's baby?
Oh. That's her choice. That's her choice.
Oh, okay. That's a good answer, yeah.
If she doesn't want me to, that's okay.
Yeah.
I mean, that's alright. That's okay. I respect that. But if I can get the chance, I would love to deliver my own kid. Yeah. But I would defo. I've asked also my other friends if they would let me deliver their kid, and some have said yes. Obviously, some would have been like, oh, I don't really want you looking down there. Yeah. But that's understandable. But majority of my female friends have been like, I would like to have a male midwife, and I wouldn't mind having you as a male midwife. And it's just obviously that rapport and that compatibility that I have with my female friends.
I mean, trust must play a big part too.
Trust, absolutely. Yeah, trust is a big part when it comes to building relationships and stuff. And I feel like when you're already a friend, you've already built that already. So it's obviously that trust in the health and safety of that particular person is imperative. Yeah. Yeah, no. But yeah, no. I would love to deliver my kid if I get the opportunity to. Yeah.
Honestly, talking about that's something I'd love to do too.
Yeah.
I'm a midwife, so I can't. But maybe one day we'll see.
We'll see.
Well, leading on to our last question.
Absolutely.
Today, Arnie. There's a movie which I think you've seen actually.
I've seen clips. Yeah.
Yeah. There's a movie called Three Idiots. Great movie, by the way, if you'd like to watch it. I'm actually not, I think it's.
Is it the Indian one that I was...
Yes, it's.
Okay.
It is a Bollywood movie.
There's
different types. I think there's. I'm actually not sure. There's a Malay version, and there might also be a Tamil version. I'm not sure.
Yeah.
I think I watched a version in Malay though, but or was it Hindi? I can't remember actually. There's a few different versions, but the movie's called Three Idiots.
Yeah.
In the movie, a character who's an engineer.
I've seen this. Yeah.
Has to deliver a baby. For context, a massive storm has hit this engineering school.
Yeah.
The lady on the table, there's no doctors there. It's an engineering school. There's no power there either.
Yeah.
It's complete darkness.
Yeah.
The only lady, the midwife, is on like this little projector screen that they've set up. And the engineer has to deliver the baby. So, he delivers the baby using a vacuum. Is this just plain stupid, or is this actually got some truth to it?
The vacuum part is true. Now,
Really?
Yeah, so that's a delivery. It's called what we call the vacuum extraction delivery process. Or not the process, but like it's a Yeah, we use a vacuum to assist us with vaginal births, and we only do it if the mum is feeling really tired, and it's a substitution away from forceps.
Okay.
And when you see forceps,
what do you mean by forceps? Like
forceps
opening
like quite literally going inside and grabbing the baby's head out.
Oh, jeez.
Try not to scare everyone, guys. I'm trying to, for my female viewers out there, look, listen, I'm all for the vacuum because I don't really like seeing forceps.
How does this vacuum contraption look like? Because I know in the movie it was legit.
It was
vacuum connected to a suction cup.
That does not happen. But if I were to, it's alright if I can show a picture.
Really.
The way that we put a vacuum on someone's head, on the baby's head, is we check the baby's position.
So it's an actual medical technique.
It's a medical technique. Yeah. It's by a person called Taj Maelstrom. And he used it back in the... I can't remember my years now.
Yeah.
Oh, what did I look up? Vacuum cleaner.
We're not using the vacuum cleaner.
Not the vacuum cleaner, guys. Delivery. And it's a weird thing to explain because it's not what you think it is. It's not actually like... Because initially, as a first year, I was like, vacuum, are we chucking a Hoover onto this baby?
Yeah.
And I was like, there's no way we're doing this, guys. But this is what the vacuum looks like. That's what it looks like. So...
Oh, wow. Okay.
It's quite an interesting tool, yeah.
Is that life size? How big would that fit?
That would fit in my hand. So
okay.
the handle's here, right? And then your little vacuum is sort of like attached. And that little suction cup that you see on the top is attached to the baby's head.
So for the audio viewers, there's this little suction cup connected by like a little tube.
Yeah.
It's like kind of like a handle.
Yeah, like a handle, and then you sort of just pump it up. Just obviously doing you pump it up, and then that attaches to baby's head. But then obviously you would obviously use like lube to get it in there and stuff. But yeah, that's the accurate representation of a vacuum. The vacuum they used was attached on a Hoover.
Yeah. So, but the vacuum technique is something that...
It's something that we use in midwifery.
Yeah.
And we've done it... I've seen it way too many times and be like, yeah, no, we definitely use it.
But it's not the actual vacuum, it's an actual... It's an actual suction cup.
Yeah.
Handheld kind of...
Yeah.
I don't even know what you call it.
Little pump thing.
Suction pump.
Yep, and then chuck the suction cup on, and then we sort of just like assist it with that process.
And you pull it out with the handle?
Yeah, so you pull it out. So obstetricians do this, not us, but if we were a rule, we might have to do it. But we sort of just, it's sort of just like touches the baby's head, and then we're sort of just like following the birth canal again. Okay. Now, the only time we do it is if baby's head is sort of like not progressing or like stuck. And then we chuck the vacuum on. If the baby's head's stuck, then we chuck the vacuum on, and we have it within 3 to 4 pulls, and it doesn't come, then it's usually a Caesar. Okay. But yeah, so.
So is that uncomfortable for the mother with the vacuum?
No, yeah, because it's like the birthing process is quick, and it's like.
And this is extending the birthing process.
But again, you're sort of just like alleviating the stress and pain, because women are tired when they go through labour, and we use the suction, we use the vacuum if they're like maternal,
Yeah.
Just tired, or if baby's head's stuck.
Mm-hmm.
I've seen the film. I've seen the clip, and I just think it's so stupid. Like, not so stupid, but this is like typical.
Yeah, I remember
media.
watching it being like,
I'm
what is going on?
like, God damn, bro.
I watched a movie recently with my girlfriend. I actually texted Annie about this.
Yeah.
Spoilers for We Live in Time. It's a movie with Andrew Garfield and Florence Pugh.
Oh, yes, this one.
A beautiful movie. Have you seen it?
I haven't. I've seen clips, and I'm like, this is beautiful.
It's spoilers though, but there's a scene in the movie where Florence Pugh's character is obviously pregnant.
Yeah, yeah.
And they're very set on delivering the baby in a hospital. But things don't go to plan. They're heading to the hospital, stuck in traffic. Events happen, they have to deliver the baby in the toilet of a gas station. And they have the midwife on the phone explaining to Andrew Garfield's character how to deliver the baby. As the gas station workers have shut the gas station, like holding the cloth over her and like keeping the door shut and everything. And it was a very interesting experience. To watch, especially because like me and my girlfriend had the thought of when the baby's head comes out, why doesn't it start crying straight away?
Yeah. Again, when the baby's head comes out, right? Obviously, it just won't be starting crying. Like when you cry, you need air. Yeah. Right. So
and obviously the lungs are still inside.
Yeah, the lungs are still inside, and so you can't really start grasping for a cry really. So the full body needs to come out in order for the babies to cry. So the baby's head when the baby's head pops out, it sort of just like sits there in like stasis, and it has its eyes closed, and there's nothing. And then when your baby comes out and we start stimulating it, bit of stimulation.
What do you mean by rubbing it?
Rubbing it and stuff, like, just good old stimulation, putting the baby on mum's breast, or on the chest, stimulating, because skin to skin is really good. That obviously stimulates crying. And obviously on a neurological level of the diaphragm and all that, gas changes occur in the baby's lungs, and obviously things in the cardiovascular system are changing as well. So when the baby comes out.
So does the umbilical cord have to be cut off before the baby starts crying?
No, it can just stay on there. We do delayed cord clamping for 1 minute, which is like 1 minute of cord of like just the baby being on mum's chest or out. And we tend to just cut it when the umbilical cord stops pulsating, or if it's in the Caesar, we just cut after 1 minute. Because obviously that baby's still getting that blood supply from the placenta, and we don't want to cut it too quickly. So
So when the baby's born, it's like lung functions are still working.
It's also getting the nutrients. It's just the lungs are trying to learn how to breathe outside, because it was so used to in this fluid sac, right? And it's obviously babies need to learn how to breathe, so sometimes babies will come out and they're not breathing. And so that comes that we have to give them oxygen and stuff. Sometimes babies poo in labour or pregnancy during labour, and that causes meconium to be stuck down there, which is this really sticky, tarry stuff that babies poo out in the first days of life, and sometimes that can get stuck into the lungs and cause what we call meconium aspirations. So that's why we use a lot of suctions, but that's obviously just the heavily medical. That's if it occurs per se. But it's so when babies come out, they just tend to kind of skin to skin,
and then they start crying.
Stimulation, they'll start crying. So
because that was a very real scene. It was a very good scene.
Oh yeah,
I reckon you should probably watch it.
I think I should, because I did see a couple of TikTok.
And
I'm like TikTok clips. I'm like, damn,
it was a very good movie.
I'm gonna like this. I'm gonna be for real. I'm gonna like this. But
so I was tearing up. Especially when the baby was born. It's like Andrew, and the acting is amazing.
It's good.
It's like when Andrew. I remember there's a scene when the baby comes out. He's like, the lady's like, you should see a head. He's like, yes, I see a head. I see a head. And I'm like, okay.
Okay, buddy. I'm like, it's not that deep, bro. It's not that deep.
I thought it was hilarious. It was a very sweet moment, though.
Yeah, absolutely. Yeah. But back to the Three Idiots.
Yes.
What was it?
So the vacuum cleaner is the suction is something that happens.
Yeah. So if I were to critique it, there are three of them, right?
Yes, there were three.
An obstetrician would never, ever advise three medically untrained professionals to perform such an invasive procedure.
Was it the best shot they had? Because there were no
I don't think so. I think the best shot they should have done was let her deliver. But I would have had the obstetrician basically walk through the engineers on how to deliver the baby.
Yeah.
But in that case, then, were they restricted by any chance? Was there flooding? There was flooding.
There was flooding, but I'm pretty sure they had an obstetrician or a midwife on the monitor explaining the whole.
Yeah.
I think they had some complications, like the head wasn't moving out or something. They had some complications in the pregnancy, which is why he decided to use a vacuum cleaner.
Yeah.
But
That's normal. You know, babies' heads can literally stay there. Like, you know, we can be pushing for an hour until we start.
Gee, how long does a normal labor last?
Oh, yeah. The second stage, the first stage, which is like obviously when you're contracting and your body's preparing itself for the push.
Yeah.
It can last days, like hours, man. Like
yeah, it's just a long time.
Yeah, just a long time. But as soon, like, you know, just a consistent, frequent contractions.
Yeah.
And as soon as you break your waters, we have an 18-hour window. After
Why is it 18 hours?
18 hours, because the woman has a increased risk of an infection during labour. So, but we start antibiotics by the 16th hour.
Okay.
I think yes, yeah. And then from that window onwards, that usually last days, man. I've known people that have gone into labour for 24 hours, waiting than 24 hours of just consistent pain.
Jeez. And
then obviously they haven't broken the waters yet.
Yeah.
And I've known women that have broken their waters and have gone past that 18 hours, so they're on antibiotics. But yeah, no, it usually happens quite a long period of time, especially for first-time mums because their bodies aren't used to it. So yeah, but we can increase that process. We can do an induction of labour.
Yeah.
That's sort of a process that the mum has to choose. Medical team can advise the mum to do an IOL if she has presenting issues like gestational diabetes, as mentioned before, or like other things like preeclampsia. But we tend to, for the more complex ones, we tend to just deliver the baby cesareanly. But yeah, no, it's a choice. It's really a choice. But yeah, no, it is a very long period of time.
Yeah, jeez.
And yeah, no, but second stage, it should happen between 1 to 2 hours. If it goes beyond 2 hours, we're having problems. Or like even 1 hour, we'll be thinking, hey, we probably need to chuck on a suction, like a vacuum or forceps or something like that and try it.
So this is when they're pushing the second stage.
This is second
once
stage,
the water's put up.
So once we're pushing, it should be 1 to 2 hours. If it's lasting 2 hours, we're having problems, and we're probably going to go to theatre.
Yeah.
But it should last an hour. But it's the best way to explain it. It's quite literally running a marathon.
Yeah.
The cardiovascular system, like the cardio output that's coming out is like 30 to 50% increase.
Jeez.
It's incredible. Like your body is just absolutely in overdrive right now, and it's obviously
30 to 40% increase is a lot.
Yeah, 30 to 50% increase. Yeah, it's crazy, right?
Yeah.
I remember reading those stats for a assignment. I was like, damn.
Yeah.
And I is like overworked, my guy, but it has to. But yeah, no, it is what it is, I guess.
Arnie, that's a lot of information.
I know.
I think we're blessed to have you on the show today.
Oh, thank you,
It's
man.
been a great convo.
Appreciate
now,
it.
to end the podcast, we have a little tradition.
Oh, okay. What is it?
Now, basically what happens is every guest gets to leave a sentence of what happens to our mascot, Pip. Pip is a duck.
Ooh.
Okay?
This is
So,
interesting.
from previous guests, this is the story of Pip so far. So Pip is a duck. Pip has 3 brothers, but Pip is a different color to his brothers.
Oh, wow.
Pip is pink, but his brothers are yellow.
Okay.
Pip looks in the reflection and gets worried. Pip was worried about his reflection, so he became emo and dyed his hair black. Pip wants to be a fighter pilot in the Duck Air Force, or a doctor, or a stripper.
Oh, wow.
So, if you could had 1 or 2 sentences about what happened to Pip next, what would you say?
Oh, easy. Pip then finds a girlfriend.
Oh, okay.
Ducklet.
Ducklet, yeah.
Wait, no, Pip. No, oh, that's sort of that. No. Yeah, duck. Yeah, we'll call it Ducklet. And yeah, no, I think that's what happened. Pip deserves to be happy.
Okay.
He doesn't deserve to be in his emo phase, guys.
So Pip finds a girlfriend called Ducklet, and does Pip exit his emo phase?
Yes.
And then Pip exits his emo phase.
Yes, that's what's gonna happen.
Okay.
Yep.
Oh, that is a great story. Arnie, spectacular.
And then someone should be following up with that and be like, Pip gets Ducklet pregnant, and
Arnie delivers the baby.
I delivers the baby, man.
A duck's baby.
A duck's baby,
The
bro.
egg pops out. Yeah, I got it.
It's just an egg, guys. I'm just gonna have an omelette.
Oh, okay.
That got
very quick. Okay, Arnie, it's a pleasure to have you on the show. Thank you for coming today.
That was clean.
very quick.
That was very clean.
Thank you for listening. Don't forget to subscribe, like, follow on whatever platform you're listening to. Don't forget to check a follow on everythingsetcetera.podcast on Instagram. Every little thing you do, we appreciate. Thank you, Arnie.
Thank you, brother.
Hope to see you again sometime.
Oh, make sure to read my article as well.
Yes.
Also...
Stay tuned for Arnie's podcast. Hopefully, releasing soon.
Yeah, hopefully.
Thank you very much. See you next time.